Joining me now, Dr. John Puntis, who's a retired paediatrician and co-chair of Keep Our NHS Public. Dr. Puntis, what are your thoughts on this? I mean, reading Lord Darzi's report, and full disclosure, I'm the daughter of two NHS nurses. I've got one kid who is an NHS professional. I love what Lord Darzi has highlighted. None of it is actually, ground-shakingly new. But then there's got to be the political enactment, and the two may not sync up. Just tell me what your thoughts are on all of this.
Well, my first thought is that less than 10 years ago, in very robust international comparisons, we were ranked as one of the best services in the world. And the reason that we're no longer ranked in that way is because of difficulty accessing care and under investment. And Lord Darzi was not tasked with saying, what do we do about the state of the NHS? He was tasked with describing the NHS. The report is good, except it isn't anything new. So it won't be any surprise to health campaigners or to staff or to think tanks. It's all been said before. And the Labour Party commitment to these three shifts into the community, more technology and prevention. Of course, those have featured in all the documents on the health service for the past 25 years. Simon Stevens and the five-year forward view said exactly the same thing, although he said, but this will need some funding. So he was a bit more realistic than Labour are being now. And I thought it was sad, but entertaining in a way, when Keir Starmer said we've got to fix the plumbing before we turn on the taps. I mean, my hospital had over 100 sewage leaks the year before last, and the Lib Dems did an exercise where they asked trusts if they'd had sewage leaks. Only 55 replied, but they'd had over 450 sewage leaks. This tells you about the state of the infrastructure in the NHS. And to fix needs money, whatever else you do, and certainly other things can be done to improve services. But to imagine you can do this without money, I think is crazy. And of course, reform is a kind of vacuous term. It doesn't really mean anything. Let's see the plans and let them be evidence-based, because the purpose of the Darzi report, according to Wes Treating, was to make a diagnosis so that the government could prescribe treatment. And in these days, treatment is evidence-based. What is the science behind what we need to do that will make things better? And at the same time, you need to have a conversation with both patients and with staff.
Absolutely. I mean, we're seeing pictures now. I mean, one of the big problems, as many people would know, is, if I can put it that way, clapped out machinery, like radiography machinery, and machines need, there's no way around it. You have to buy new machines. You have to keep technology up to date. So this whole thing of no money without reform, surely you need the money in order to reform, don't you?
Absolutely. And in terms of equipment, for example, that you've raised, I mean, in the OECD rich countries list, I think we were second from bottom in terms of numbers of scanners, and much of the equipment that we have is outdated. And when it comes to outcomes, people often point at the NHS and say, well, your cancer outcomes aren't very good. But if you can't diagnose people early because you haven't got the staff and you haven't got the kit, then of course outcomes are going to be poor. It's a nonsense to imagine that you can transform things without investment. And also, new technology, will help, but it's often expensive. There's an obsession with artificial intelligence. I don't think that's going to be the answer to the NHS problems, but it will probably involve the NHS being lobbied very hard and buying a lot of stuff that doesn't work very well. So that's something we need to guard against as well.
Now, one of the things, because I think it's pertinent there, is, again, as you say, that age-old thing of more community-based services. And yet the social care sector is in shreds. I mean, it's hard to see how you can move people from beds, and we know that people are often in beds because there's not adequate social care, without doing some real work when it comes to the social care end of things.
Absolutely right. And it's a nonsense for the government to talk about reforming the NHS if they're not going to reform social care, which I think should be put on the same footing as the NHS. But about 1 in 7 beds, as you know, are occupied by people who are fit enough to go home, except for the fact there isn't community support. This also then backs up through the entire system. So you have patients who are sick, waiting to be moved from A&E to a bed, but there's no bed for hours. And this is why it's estimated that about 14,000 patients a year die avoidably because of having to wait in A&E. At the same time, you have the ambulances who can't discharge their sick patients because A&E is absolutely teeming. So the first thing I think you'd want to do is to sort out social care. And yet it doesn't seem to be getting a mention anywhere.
No, I didn't see any mention of it at all. And I talked about, as you said before, talking to patients or service users. John, you know, that point that I made, the National Health Service does rely on charities in many sections, doesn't it? Mental health is one of them. I think another one is palliative care as well, and what have you. And it almost seems that, you know, just to repeat what I said, it almost seems that many people, decision-making or politicians, rule out or don't include things. They give lip service to it, but things like mental health and palliative care and social care, because charities will mop that up.
Yes, and with social care, of course, families as well, so carers, mainly adults, but actually tens of thousands of children who are the main carers for adults with chronic disability. So this massive burden that's shouldered by families in terms of caring for people. And I think that if I can just go back a step, the 3 shifts that has committed to are not novel. And I think my organisation would actually say there should be 4 shifts. The first is, for goodness sake, fund the NHS properly so it can work properly rather than underfunding it. Roll back privatisation, because that's not been helpful. For example, 1 in 9 mental health inpatient beds are now provided by private companies. That costs the NHS and the taxpayer $2 billion a year. And the profit margins on those contracts are said to be 10 to 15%. And then finally, do something about the fragmentation of the NHS. We want a national health service, once again, instead of this fragmented service now divided into 42 different parts. And our 4th shift would be to sort out social care with a national care support and independent living service. And if the Labour Party really want to be bold about this, they should think back to 1948 with a war-ravaged economy, where they agreed that we couldn't have economic growth and a strong economy unless we invested in health and had a good health service.
Absolutely, absolutely. And they talk about the numbers of millions of people who aren't going back to work through ill health. And it's all about having a sick NHS. Thank you so much for your time. Dr. John Puntis, a retired paediatrician and co-chair of Keep Our NHS Public.